Very good afternoon to everybody present here. Myself, Dr. Aditi Joshi. I'll be presenting my paper on a new foe in endogenous endophthalmitis. So, a 13-year-old male presented with right eye gradual diminution of vision since 1 month. He denied history of trauma, systemic illness. He was already diagnosed elsewhere as hypopyon uveitis and treated with topical and systemic steroids. His entire uveitis workup revealed a negative MON2 test, a normal ACE enzyme, a negative serology for syphilis, and normal chest X-ray. So on presentation to us, his vision in the right eye was perception of light, and in the left eye was 6/6 Examination of the left eye was unremarkable. The slit lamp examination of the right eye revealed circumcorneal congestion, multiple iris nodules, large mutton fat KPs, and fluffy exudates over the iris and cataract. The ultrasound B scan revealed presence of dense hyperreflective echos with membrane-like echo in the vitreous cavity in the right eye. So a suspicion of endogenous endophthalmitis was made, blood and urine samples were sent for culture and anterior chamber paracentesis was performed. The anterior chamber tap revealed gram variable bacilli. Smooth flat greyish colonies with few microcolonies were observed. The organism could not be identified by routine biochemical tests. Based on the sensitivity report, the child was started on parenteral antibiotics and was planned for lensectomy and vitrectomy. So this is an intraoperative video showing after collection of the undiluted vitreous sample and after lensectomy. Here we see fluffy white clumps of pre-retinal exudates in the periphery and mid-periphery that were being aspirated. The gram stain revealed plenty of neutrophils and gram variable bacilli. On culture, similar flat greyish colonies showing a few microcolonies were observed. So to identify the organism, we performed sequencing of the 16S sRNA gene. The 16S RNA genes were amplified by PCR. The bacteria was identified as Peanibacillus latus, showing a 98% homology match with the NCBI database. The bacteria were sensitive to vancomycin, amikacin, cefotaxime, ciprofloxacin, and resistant to ceftazidime and tobramycin. Blood and urine cultures were negative. 2 weeks after surgery, the patient developed rhegmatogenous retinal detachment with a small temporal blade. The patient underwent a second surgery with endolaser and oil tamponade. The patient was followed up at 4 months. There was silicone oil emulsification. The fundus was stable. He underwent oil removal with secondary intraocular lens implantation in the ciliary sulcus. BCVA at follow-up was 6/9/6 with a pressure of 10 millimeters of mercury. So Peanibacilli are gram-positive aerobic bacteria that are related to the Bacillus species but differ in the DNA encoding. The genus consists of more than 100 species. Human infections with Peanibacilli are being reported with increasing incidence. Due to improved testing and identification, it appears that these infections may not be as rare as once perceived. Majority of these infections occur in setting of immune compromise or secondary to trauma. There is a single report of P. gluconolyticus causing keratitis and P. alveoli causing endophthalmitis. As we all know, endogenous endophthalmitis is a devastating cause of vision-threatening ocular infection. Compared to an adult, in children it is quite rare and it often masquerades as orbital cellulitis, uveitis, leading to a diagnostic delay. There is a diverse spectrum of pathogens implicated in infectious endophthalmitis with reports of rare and emerging microorganisms increasing. A major reason for these novel findings is because of developments in the microbiological and diagnostic methods. Our patient was initially diagnosed with uveitis with clinical signs were challenging to differentiate from uveitis. In addition, the absence of any recent history of systemic illness, surgery or trauma or intravenous medication in an otherwise healthy child made the diagnosis of endophthalmitis quite challenging. From review of literature, we could find only one other case of P. Latus infection where it was isolated from a case of bacteremia. So our case highlights the use of 16S RNA gene sequencing as an accurate method to identify rare pathogens. It also underscores the importance of reporting gram-positive spore-bearing bacilli and not ignoring the isolates as possible laboratory contaminants. This is the first report of P. latus as a pathogen in humans causing endophthalmitis, mimicking granulomatous uveitis. The inability of gram stain and biochemical tests to identify the bacterium was overcome by using newer techniques. These are my references. Thank you.